Sorry, she has microcephaly. That does not affect her health.
No, the micro.
Wow. So now it's confirmed that she allegedly has microcephaly. Oh my God. Okay, microdeletion is one thing. Microcephaly is a really big deal.
And Bree's out here doing the most, trying to pass it off as just a small head to everybody, but that's just not the case. Who are you going to believe, Bree or your own lion-ass eyes?
Yeah, microcephaly is a big deal.
Absolutely. So microcephaly is the opposite of macrocephaly. Macrocephaly is a larger head. Microcephaly is a smaller head. So how pediatricians diagnose that is that we will measure the baby's head and we plot it on the growth chart, and it will be at the 3rd percentile or lower. That is how we medically diagnose it. And it can be due to a number of things. Typically during the pregnancy, it could be due to exposures, like if mom smokes, if mom drinks, or she does drugs, if she does not get the adequate nutrition that she needs during the pregnancy. And also, more commonly, is infection. So certain viruses, CMV, Zika virus, these kinds of issues can cause a smaller head and a smaller brain. Typically do work at microcephaly more than macrocephaly because we are concerned for viruses, because it can, if the child has that virus, it can cause issues with vision or hearing or developmental issues that we really want to get ahead of. I will say that right after baby's born, they will have like overriding sutures, so the skull bones can overlap during a vaginal delivery, so the baby can be delivered. And if we immediately measure the baby's head and put it on the growth chart, it could be lower than it will be once those skull bones return to the normal positioning, if that makes sense. And a baby's skull grows because the baby's brain is growing. So if we have a kid with the 3rd percentile, but when they come in the next time they're at the 5th and then the 7th and then the 10th, and it kind of is increasing but not at an alarming rate, then we aren't very concerned with that microcephaly if the kid is also meeting developmental milestones and has a normal exam. Now, if they have other abnormal exam findings, they have abnormal movements, they have seizures, they have poor feeding, any of those things are definitely going to make us want to work that up. And like with macrocephaly, if we have a kiddo that we have concerns with the smaller head, we will get brain imaging like an MRI or a head ultrasound to take a look at the brain structures and see if everything is normal. Some other things that we sometimes find with babies with smaller heads is calcifications, which can be indicative of a toxoplasmosis infection, which can be caught by the mom during pregnancy with changing cat litter, which is why moms are told not to change the cat litter during pregnancy. Some other causes of microcephaly could be genetic syndromes. It could be abnormal blood flow to the baby during pregnancy. If the baby had in utero a stroke or a hemorrhage, that can cause issues. Or if the baby is very malnourished after delivery, that can result in microcephaly.
In microcephaly, the brain fails to grow to normal size, and thus the skull remains small. The head of this 18-year-old microcephalic measures 14 inches in circumference, whereas 22 inches is normal. In microcephaly, there is an irregular development of the cerebral cortex, with a lack of brain cells most noticeable in the parietal and occipital lobe.
For more severe cases, babies will need ongoing care and treatment focused on managing their health problems. Developmental services early in life, aka early intervention, often help children with microcephaly. Babies with microcephaly can also have multiple health problems, depending on the severity. Common problems include seizures, developmental delays such as problems with speech and walking, intellectual disability, problems with movement and balance, feeding problems such as difficulty swallowing, hearing loss, and vision problems. Kind of sounds like Gypsy, huh? Close your eyes and pretend you're a first-time mom or dad. You're looking at your beautiful child. The doctor keeps talking about being concerned about something being wrong with your child, and they give you a word like microcephaly. As a new parent, imagine how frightening that is. Are you not going to look into it and see what it is? You're not going to want to know what kind of symptoms or effects it may cause? Take a deep look into microcephaly. You'll see a lot of the concerns that Dee Dee had for her daughter.